Making decisions about which treatments to cover is an important and complex task. There's many efforts that are going on in the United States to improve the amount of evidence that we have to make a decision, to improve the quality of the evidence to make a decision, and to ensure that the evidence is used in clinical practice. For payers, they have many important tasks as well. They have to make decisions often when there's incomplete evidence. So we wanted to understand, when do payers need more evidence about which treatments to cover? And secondly, when they need more evidence, what type of evidence do they need? To understand when more evidence is needed and what type of evidence will meet those needs, we convened a roundtable of payers and other experts. In this roundtable, we found 4 things. First of all, payers don't often want more evidence on specific outcomes. They don't want 3 or 4 studies assessing the same information. They want to understand how to make the decisions and how to move on quickly. They want to understand when they have clear differences between treatments. Secondly, we found that payers often need more evidence in a timely manner. So trying to make changes when a care pathway is already firmly established, clinical practice guidelines are being used, evidence is less useful than in cases where it's still uncertain. The third element is that payers often wanted broader outcomes. The information that they get from registrational trials that are used by the FDA often may not account for the outcomes that matter to them. Outcomes like total cost of care, long-term safety, or understanding which patients, which treatments work best in, is what matters to payers. And last, we often found that real-world evidence was going to meet that need. High-quality, real-world evidence fit several of the needs for payers. Payers want to make the right decisions for their members. Not only do they want to make the right decisions, but they want to be certain of those decisions. And we can all understand this because we all make decisions in our daily life where sometimes if you were asked, is that your final answer? You might change your mind. So we need the right information to be available at the right points in time. This matters to researchers, funders, and the biopharmaceutical industry because we want to ensure that the evidence and the research that we're investing in is going to be used by the end users. And as providers and as patients, we want to make sure that the evidence is going to be there to help inform the decisions for the care that we're receiving today and tomorrow.